Okay, guys, this is Dr. Sean, and it's Fortis week 6. And so we're working on the week 6, as you can see, wait, over there. Over there, you can see the lab. It's week 6. Case study trying to conceive. Conceive is to have a baby, right? And so we're going to go over here and we are going to begin it. And it's a little story about Victor and Alicia, and they're trying to get pregnant. And so they had a wise idea to use some planning. And that planning is trying to get pregnant around the 14th day of her cycle, so halfway in between. And it asks the question, why might this not be successful? So you remember that little diagram that you've probably seen every look up the menstrual cycle, and it'll show a big wave that goes like this or whatever, and it'll have different things that happen. You know, the ovum is released from the cyst, and then the ovum travels to the uterus, and the endometrium begins to grow. Wow, a little mental hiccup there. Um, and so what you're going to do is you're going to go look through that entire thing and just see where the places that are best to be conceiving from. Some people do this method. They do it like a calendar method also for birth control. So as we get in through here, we have two different things, our drop boxes. I'm going to go through them really quick. Male reproductive system on the left side of my screen, and female reproductive on that side. Let's see, we have these things which we have to put around. Now, the gamete, remember, that's the main little sex cell, right? A half cell, I guess you say. So the sperm, the motile means moves around, right? Non-motile means female. That just sits in place mostly. Gamete typically made one per month. That's going to be an egg. That's female, right? It's made in the ovary and then popped out and goes down the fallopian tube and ends up in the endometrium, where it can implant if it gets attached by the sperm cell and it gets fertilized, right? Mature gametes have reduced amount of cytoplasm. Cytoplasm is the stuff that's around the nucleus, right, and helps support the cell with a lot of different stuff. Now, the sperm cell has very, very little. It actually has just that acrosome. It has that little first part, which is a little enzyme to break through the wall, and it has a little what's it called? A little motor, and then it has a flagella. So this one here, reduced amount of cytoplasm, is going to be the male. Gametogenesis begins at puberty. That's boys. Okay, that's his boys. Millions of gametes produced per month. That was also males, because females only produce one. That's why one gamete available there, and millions. Gametes complete meiosis upon fertilization. Meiosis and mitosis, that goes there, and gametes are present at birth. Those are also the female. So remember, you're as a female, your gametes are present, like even when you're in the womb, right? There's like 40,000 of them, and they're reduced down to like basically 4,000. And then as you go through your entire life, if you never had kids and you had all your periods, you'd have about 400. So let's see how we did. Did we get everything? We missed. How are they non-motile and motile? Male reproductive, motile, and non-motile. I'm gonna have to look that one up. That's terrible. Okay, we'll do a different one here. Drag the words into the correct boxes. If a man and woman have unprotected vaginal intercourse, notice they detail that out. What are the structures of the female reproductive tract in order that the sperm would move through? Assume that these sperm do not die prematurely before they reach their final destination. No one goes and attacks them, nothing like that. First, the sperm would enter, let's see, the vagina first, and then it would pass through the cervix. Then it would do the oviduct, and then it would enter the uterus and then into the oviduct. There we go. Let's check it. And we did good on those ones. The oviduct is basically, we're talking fallopian tube. Remember, like I probably said earlier, they're taking words like fallopian, which is a person's name, out of it, and they're using it as an oviduct, a duct for the ovum, ovaries. Okay, let's do this other one, next one here, see what we get. We're at like 4 minutes, 20 seconds. I don't want to go too much. There we go. This is week 6, so we're done with the lab. That was pretty easy, right? So we'll go through that in another video. I already did that one. Weird. Huh. Did I do that one? Okay, I guess we did that one. Wonderful. Anyway, keep doing what you're doing. Don't forget to go down to that side, way down there, and there's over on the edge, there's a little thing to subscribe if you want to, or to watch the next video, which I'll try to put, I guess, up there somewhere. Hey, take care, you guys. Do good. Don't forget, everything's due on Friday night, so make sure you do your work, and this is the end of week 6.